recorded. So guys, it's recording. Okay. So make sure that all the columns are filled. Never ever leave any columns empty.
Are you
Anyone
just
have?
saying based on your experience, or because the ones the
See,
CBD I
basically,
had mines accepted, it didn't say anything about those.
no, no. Basically, it all depends upon the assessor. For example, if the assessor is strict and he wants to have a look at all your reflections and all the case details, see, then he might say this is not level four. Like there can be a
No,
discrepancy
no, you
saying
can't
that.
even submit if it's not a level 4. The point
Yeah.
is, when you are submitting it, you're making it level 4, and then you're submitting, isn't it? So there's
So
no point. There's no point going back in there unless there is a development of that particular topic. What I'm trying to say is, because writing all these takes a long, long time. And is it just like a robust thing, or is it just your opinion that there is optional? Because some of my CBDs which has been
no, no.
accepted.
See, basically, it is not my opinion. See, whatever I'm saying is, the Royal College gives you something optional. It's not for the what I can say. See, the trainees can keep it optional, but not as a Caesar candidate, not as a portfolio candidate. Your portfolio, as a portfolio candidate, I will say yes. Go ahead with all the columns. Fill everything as much as possible. More elaborate. See, I've seen trainees just mentioning whatever just mentioning I did well. That's it. And you have to, because it's something different for
Yeah,
the
that makes
trainees.
sense.
This CBD templates are not made for the portfolio candidates. It's all made for the trainees.
And
But
there
if
is
you're
nothing for portfolio candidates, isn't it? So
Yes,
you have to use one of
exactly.
those.
So there's nothing for portfolio candidates. You are just copying the templates for the trainees and you are trying to fill those things. But as a trainee, they have ARCP to assess and they have their own education supervisors. They are assessing everyone. But for you, it's going to be the portfolio assessors who's going to assess your papers, not your performance. So you have to say that I have done all these things. I'm good at this thing. I'm good at communication. I'm good at patient communication. I'm good at follow up. I'm good at doing some research. I'm good at doing some audits on these topics. I know what is the current guidelines on this topic. So, for example, if you're talking about sepsis, you have to talk about sepsis 6 and all the recent guidelines, and at least mention something very extremely recent from the sepsis.org and see that this has been changed from here. Read about the topic before you do a CBD. That's what I will suggest. Read about the topic, read the recent guidelines, and go ahead and do the CBD.
Can you show the like index? I mean, doing the index is a bit of a tricky thing. Do you have any sample of indexes which has been accepted?
I see. Basically, I no, everything is in junk. I think I have to search for it. I can do it sometime later at some other workshop. I think not now
Because how
because
you index it. Because I had a lot of issues with my both the applications. Like
no, no.
I did it
That's
like
what, like, see. Basically, I'll show you the PowerPoint which I showed now.
yeah.
So sit. Okay, once again. Uh, Okay. See, this is simple sample of the, I think everyone can see. So basically, when you're indexing, make sure you go to the number one column should be serial number, the date of I usually say when you mention about the index, mention about what is the case discussing about. Just copy paste it from SHG guidelines. For example, you have something called as sepsis in your SHG guidelines. Mention a column saying that what is the descriptor from the SHG guidelines and what is your case based discussion title. If you go and see the
How did
thing,
you put a 1, 2, 3 like randomly?
which one?
Like the case number you're saying.
Yeah, that's okay. The case number is just serial number 1, 2, 3, 4, 5.
No,
That's
that's what I'm saying. Like, so it can be a random, whichever you want to choose first, isn't it?
Yeah, doesn't matter. What I will suggest is just follow the same line of arrangement what is there in the guidelines.
Yeah, but
SSG
guidelines is
guidelines.
not very obvious, Varun. I mean,
No, no,
it's
no.
easier said than done.
It is
So the
perfect.
guideline basically says that you need to put the details of who's
No,
done
no.
it.
I'll say I'll tell you something. I think it's out of the topic, but still, for the purpose of things, I will say here. For example, I think let me just. If you go to the SSG guidelines, it will say what exactly.
No, no, but
Uh,
when you index it, should it not be like CBD, say for example, acute bowel perforation, date this and page this? That's what it means, isn't it?
yeah, that's what I'm saying. Like, see, basically,
But
if you
you've done it completely differently. What how I've done it.
okay, I'll tell you something. So this is the. Uh,
Because you know what my understanding is, say for example, you're doing
One second,
CBD.
I'll show you something.
Yeah.
I'm the page now. I'll show you something. Where is my website? Yeah. Okay. I think this is the SSG guidelines for the. I think you
Yeah.
can say this is the SSG guidelines, recent SSG guideline for the surgery for the
Yes.
case-based discussion. My
Yes.
index will be serial number one, and case descriptor is assessment of acute abdomen.
Yeah.
And then what is the title of your case? Like I can say assessment of a patient who came in with acute abdomen.
Yeah.
Who's the assessor? So that is your case number one. Case number two, strangulated hernia. Case number three, obstructed hernia. Case number four is intestinal ischemia. Case
But
number
there should
five,
be page number as well, like which
page.
page this.
That is something last. Okay, you have to do it lastly. This is the index actually. On what I'm talking about is index, intestinal obstruction.
So
And
index is last though, isn't it?
no, you see, once you make the index, you know how many cases you have done and how many cases you have not done. I will say just prepare a Word document on the index and then you will know how many
So
cases
you know,
you have
I
done.
personally had a lot of problem with it. The GMC rep said something, college wanted something. You
Now,
know,
I will just follow this thing because this is your Bible. You just make an index saying number one, my
and
case-based
in my
discussion is
first
this.
application, they said, "Oh, you did not mention the page number. There was no mention about the page number." So
Page
if it's
number,
saying, say for
it's
example, if you're saying like strangulated hernia, you can say easily case number this, and then you need to mention at the end the page number is from 6 to 9 or whichever page, because the SSR don't look for these things. If they find any issues in finding the
see,
problem,
GMC is doing a clerical job. You have to mention about those things. So what I will suggest is my as a Royal College assessor, they will look into all these numbers. They will look at all these topics. Or if you have any specialty specific, you can go to the medicine. You can go to the things whatever the
no, Varun,
specialty is.
listen, they don't. So if you don't put the page number in there, it will become like they would not look at it. So this is the feedback I got in my application.
See, what I'm
So
saying is the page number is mandatory because
page number
as
is mandatory, exactly.
yes, page number is mandatory. You can't
Varun,
submit.
someone's raised hand.
Yeah,
Vinay,
Vijay. Yeah, Vijay. You can just go ahead, Vijay. Yeah.
Hi, thanks. I was just wondering, all of these are electronic uploads. So, how does page number come into this?
So you have to. I think you have not started your application if I'm
yeah.
not wrong because
So
Adobe.
CBD will come as a file,
No, no.
any one
Hang on, hang on.
file.
I'll tell you something. First thing is if it is electronic, download it from your whatever the electronic format. Use your if you have Mac, iPad, iMac. There's something called as PDF gear which is free of cost. You can merge everything and you can add your page number.
Okay,
That's a separate what I can say. That's a technical or clerical work rather than a professional work. Okay, and if you don't have iMac, you can use Adobe Pro version that will help you to input the page numbers, merge your PDF and also the page numbers.
sure. Okay.
And that
And
is Adobe Pro. If I'm not wrong, I used it a year back. It was £20 per month. I will suggest download everything PDF. Once you get everything downloaded, use £20 to just before your application submission. Use your Adobe Pro and just consolidate everything whatever you need. Yeah, go ahead, please. Yes, Vijay. Vinay.
No, yeah, that's very useful actually, because I didn't understand where we would sort of mm, name them by page essentially. And when you say indexing, is that for sort of each individual subsections, in the sense those CBDs then get indexed separately, and then do
See,
reflections get
you
indexed
can.
separately?
I don't get you. So index means
Varun, shall I
the
answer this question? Because
yeah.
so basically, when you submit your CBDs, all WBAs, basically work-based assessments, whether it's CBDs or PBAs or CEXS or whatever, it has to be indexed. So, say for example, all your PBAs has to be indexed at the beginning of the folder or at the beginning of the file. So if you're putting all the PBAs in one file, one after another, you need to mention this indexing, that this page number 1 to 5 is acute bowel perforation, page number 6 to 7, this date, etc. That's how you need to index it. And when the SSR looks at this folder, they follow these pages and they assess as per the pages. So if you do not put, yeah, it's something like that with a page number. So that
Guys,
may,
I think this will explain you everything. Okay,
yeah.
this is the first page of your CBD for any hospital. You are giving the this is for the GMC advisor. So there are two components here. One is GMC advisor who assess your validity of the, what I can say, like your perfection of the application. They are not assessing the quality of the application. So they are assessing, is this application okay to be sent to the Royal College? So this index has to have page number. I think, sorry, I'm sorry. I think there's no, the last column is not here. So the case number is just serial number, your date of assessment of CBD, the what the CBD or what is the descriptor. For example, as I said, sepsis is the descriptor expected from the SSG guidelines, and you can add another column saying that this is the descriptor from the SSG guidelines. I am giving a topic on this descriptor saying sepsis in a patient who had a Fournier's gangrene, sepsis in a patient who had pneumonia, sepsis in a patient who had something like that. And then who's the assessor, what is the outcome, and there must be another column here in this thing called as page number that has to mention this is just the first page of that PDF. This is a separate topic, guys. I did not meant I did not think of doing this separately, but we can do it on a separate occasion, separate day. So this is your first page, and following this page you will have the CBDs arranged one by one as per the index of the CBD. So this document will be a one PDF document submitted to the GMC. The GMC will look into the page numbers of this case. Is it corresponding to the same page? For example, you have mentioned this acute PE as page number 2. And if there is something else in the page number 2, the GMC will come back and say your page number is not correlating with the pages. I think this will make sense.
Yes, it does. Thank you. Um, I know we're short. We've already overstepped our time, so I'll just
Yeah.
ask questions separately on a private
We
message.
will
Thank
have
you.
another session if if guys are happy. I will have another question, another session, because I know that I thought it will be a simple topic, but I know.
No, I think you should, Varun. It's an extensive topic, and to be honest, it carries a lot of weight in the application.
Yeah, I
Because
know.
this is something. Because I think these WBAs, they carry a lot of weight in it, and it has to be right in order to get your Caesar.
Yeah, once
This has to be
let
right.
me finish it, and then we can talk about it a bit more later. I think there are another few 10 to 15 slides regarding this. Okay, let's
But
finish
we are
this.
already running out of time, Varun.
I know.
We'll do it another day.
It's I think I will finish it because I don't want to go for the another day, because uh, it's up to the other people. Oh my God, what's happening? Okay, so quick. Let me finish it quickly. The next is the procedure-based assessment. It will be similar to the case-based assessment, but there is few things which you have to think of. This is only for the surgeons, those who are applying for the surgical specialty. Any surgical specialty, you will have procedure-based assessment. It assesses your technical skill, clinical judgment, professional behavior during the procedure complete. So make sure, again, the same thing which I'll say, make sure that this is mentioned: age, sex, relevant comorbidities, and what type of procedure. Was it an elective procedure? Was it an emergency procedure? Complexity of the procedure has to be mentioned in your general topics. This is one of the thing which this is from my thing. So for example, you did an emergency appendicectomy. What is the who's the trainee, what is the assessment date, make sure that the who's the rater there. This is from ISCP, it automatically goes in there. Rater feedback. So my rater has given, he did a safe operation was performed, safe dissection and handling of the tissue, good guidance, guidance to the trainee. For example, if I'm assisted by one of the SHO, I can explain saying that, oh, this is what is this is what is this, and improve communication. So development need saying that, oh, I have to improve communication. There's no recommended action, it means that there's no action needed. Okay. Key points for completing the PBA: it has to be appropriate, choose an appropriate procedure, get the things from the SSG guidelines, complete the patient details and case details accurately, detailed procedure description for sure should be there, document outcomes and complications. If there is a document outcomes, if there is a complication, mention about the complication. There was a bleeding, I was appropriate in controlling the bleeding, and make sure that you have a trainees reflection. Again, trainees reflection, you have to think about smart mnemonics. Learning points has to be mentioned. Make sure that your signature and the uh, assessment date and your validation date has to be at least 1 week like it should not be more than months and months. It should be just weeks. That's the best way, the best procedure based assessment. If you say your assessment date is today, and if you get the validation done like 6 months later, or you have done the you did the procedure today, your assessment is after 1 month, and your validation after 6 months, they will reject this PBA in the application. Signature and dates, as I said, do not backdate or pre-sign the forms. This invalidates. If you are not able to, if you're planning for a pre backdated thing, make sure that you get it in the paper forms. That will help you to have a valid PBA. Ensure both signatures are legible and complete. Make sure that your hospital seal is available on the paper forms. If you are in the e-portfolio, it picks up automatically, and if it picks up automatically, you will have all the assessment date. Your assessment date has to correlate with the logbook date of operation. Make sure that the logbook date of operation, your assessment date coincides. If not, then your PBA is not a valid PBA. Keep a copy of PBA. If you have a signed copy, that's fine. And reflection, as I said, you have to make sure that your smart reflection has to be there. Make sure that you have a honest PBA done. Example, I said I recognize that my, so this is what I can say that you what need to be improved. I recognize that my knot tying speed could improve, and I plan to practice this more in the, so this is what development is needed, what is my strength, what is my weakness, what should I improve. Trainees comment has to be self-assessment of performance, challenges faced, learning points or skills gained, areas of improvement has to be definitely mentioned. I will say again, as a PBA 4A or 4B, there should not be area of improvement except saying that I want to do an audit on my complication rates, I want to do an audit on my perform timing of my operations, something like that, which will help you a lot. Impact on future practice, you can say that my I will go and have a look at the research evidences to say what are the complication rates, and is it coinciding, is it comparable to my complication rates. Specific, just this is a example of a PBA for a laparoscopic cholecystectomy. What I can say is, what specific thing which I noticed is, like, during this laparoscopic cholecystectomy, I performed the dissection of carotids perfectly, and my supervisor was happy. I did not do anything blunder in my carotids triangle. What is measurable here is its critical view of safety is correct. I did the critical view of safety without any problem. Achievable, I will further improve my efficiency. So you have done everything fine, and also you will try to improve it more in that technique. Relevance is enhancing these laparoscopic skill is essential for my progression towards independent operating in general surgery, um, particularly for biliary procedures. Time bound, I will try to do a course on laparoscopic suturing, which will improve my improve my laparoscopic skills, something like that. So you don't need to mention all these things in your PBA. You can just mention this, but this couple of sentences or 3 to 4 sentences, which will be the best way to things. I perform the dissection of carrots under direct supervision, achieving the critical view of safety without complications. I plan to improve efficiency in port placement and dissection by practicing simulation. But this is something which is for like level 3, I can say, but you can do it for level 4, saying that I did well, I did this thing well, I did this thing well. I will try to improve more, and I will also audit my my skills, that which will help me. Levels of PBA as required. For example, sometimes they might ask only level 3, sometimes they might ask only level 4. So it depends on what kind of levels you need from your from the SSG, but it has to be from your boss. You send it through electronic format, your boss can change it. Even if you say 4, he might give you 3B or 3A, or you can send it like 3, he might change it to 4. So it doesn't matter, but whatever the level which you need for your application, you have to be careful in that. Don't submit anything which is not required for at your level. If they ask for 4, don't submit something 3. That's not, it's not going to be useful. And the assessor might say that, oh, it's level 3, it's not acceptable. Better to submit whatever the levels needed. That PBA can be submitted, not the other PBAs. This is one of the index PBA which I submitted. So basically, this will just follow the same line of SSG guidelines, like umbilical hernia, emergency laparotomy. Just I did the index from the SSG guidelines, and who is the assessor, date of procedure. All the SSG guidelines has got some index at the last pages, whatever the things what they want, and what is the levels which you have, which is there, and that these things has to exactly be there in the CBD, in the PDF file which you are going to upload. Triangulate, make sure your logbook and the PBA dates matches. Ensure if the complications are mentioned in your PBA, that is also should be mentioned in your logbook. Major complications should be mentioned in the appraisals, because they triangulate, they go and see is there anything in the appraisal or in the M&M meeting which you had done and that has been discussed. If there is a death, make sure that it is present in the death audit meeting. Any complaints regarding the procedure can be also included in your compliance section. Post-op follow-up letter, if there is any letters say, similar to the procedure which you have done, like for example communicating with the patient, I did an emergency laparotomy on this patient, are you doing well? If there is any complication, please let us know. Or you reviewed the patient in the clinic, this patient had a laparotomy under my care, I reviewed this patient on this day, I found that this patient is doing well, or I found that this patient still has problem, there's a recurrence of hernia, whatever the things, and you just mentioned that letter can also be included in your application. DOPS, I don't think it's time. It's similar to PBA, and it's similar to the um, similar to the CBDs. I can do something on this later. Mini cakes and tops, we can do something later. Thank you, guys. I think I want everyone to give a feedback. Let's have a discussion. Anyone wants to talk another 15 minutes? I'm happy for any questions to be answered. I'll just go to the chat box and I explain two things. People, those were in the chat box. Thanks, Abdul. Can you also try to focus on other specialty, non-surgical? Yes. What kind of thing which you need? Please email me. We can have other people to come and speak in the forum. Related to this, there is kind of anywhere else about the topic to be covered? Also, is there a source for Royal College guidelines on cases like sepsis? Yes, the SSG guidelines. There's something called as related to this. Is there a guide from the college or anywhere else about the topics to be covered? Also, there are any source for Royal College guidelines on cases like sepsis. See, basically, if you go and Google it, like sepsis guidelines, PE guidelines, nice guidelines for PE, something like that, you will get all the guidelines anywhere. Or if you don't have any, if you're not getting it in the Google, just go to Chat GPT and just check what are the guidelines. Make sure that your guidelines are nice guidelines or UK guidelines. Don't ever quote any USA guidelines or some other guidelines. The UK bosses doesn't like US guidelines. What's the difference between CBD and mini cakes? Mini cakes is clinical examination. CBD is case based discussion. Mini cakes is something Abdul is. This is for Abdul Hasan. Mini cakes, for example, this is for abdominal examination. Is mini cakes. It's not a case based discussion. Discussing about a patient who has come in with pneumonia and sepsis is called as case-based discussion. That's the basic thing. I feel they look the same. No, this is not. It's not same. It's different. Mini cakes, examination of the abdomen, examination of the groin, examination of chest. These comes under mini cakes, and it doesn't come under CBD. Case-based discussion. You have to discuss about a case like patient came in with chest pain and discussing about causes of chest pain, differential diagnosis of chest pain, investigation, and then you are coming to a conclusion either it is an MI or it is a PE, and then discussing about the investigations, management, reflecting on it. Again, reflection: what went well, what should I improve, and how am I going to improve? Jayant, ACP, CBDs are okay online, but consultants don't respond to them most of the time. So if your consultants are not responding to them, better do a paperwork and ask them to sign it in front of you. That's fine. That's the easiest way. If you don't have a paper form, just go and download it from my website or from the um, Royal College website, whichever template, doesn't matter. Can AI be used to improve the language after feeding facts? Yes, of course, yes. The grammar can be corrected. That will help you have a formal AI. Grammarly, I use plenty of times. I use Grammarly. Grammarly is a bit costly, I think, if I'm not wrong, but still it is good. Your V's one, I won't use any AI platform to copy paste. You can use it, which I discussed already. This reflection is part of CBD format or a different activity. Yes, it's any application should have reflection. Reflection has to follow the smart mnemonics. Make sure that at least you follow a couple of smart reflections. Kicks and CBDs, what's the difference? Clinical examination is completely different from CBD. As I said, clinical examination includes like mini kicks. Like that's what I said. I think I discussed about this. Uh, please continue. Please continue. Apologies. Do we need mini cakes? No, there's no need for mini cakes for the portfolio pathway as a surgeon. But I don't know about the other specialty. You have to check your SSG guidelines. Uh,
Medical, we use it in medical miniclex very commonly. Sorry, this is Dr. Hassan Abdo. Yeah, miniclex is sometimes used. We use it in medical specialties many times. This is why I ask about it. Yeah,
yeah,
miniclex is
yeah.
still use it. Yeah, not
What I'm saying
maybe on the
is,
surgical. Yeah,
you
thank
have
you.
to go to your SSG guidelines and see what mini cakes they need, okay, or how many mini cakes they need. If they have mentioned that you need 10 mini cakes before the application, you have to do that mini cakes. Discuss with your boss what mini cakes, or discuss with your trainees what are the mini cakes which you want to what is this, which you need, which you can. Another thing, whatever the things which you do, it has to be at the level of consultant. It should not be like SHO level mini cakes. Make sure that you do it at the level of consultant. There was a mention about timeline. If I managed a case 3 months ago and I do the CBD now, no. Yes, something called as Sarita, someone called as Sarita Bosco. No, you can't do it retrospective. make sure that if you're doing something retrospective, it might be I think CBDs they accept, provided if it is within that period of your training. But if it is something which is like 3 months, 6 months, I will say better to do it paper form, and your assessment date, your validation date has to be so close rather than keeping it months. There is something called as quality check at both the levels, like GMC level and also at the Royal College level. The quality check is, does this PBA and CBD is validated, is a quality CBD. So it means that what are the quality indicators? Is the validation date is closer? Is the validation date is like wider? Is the assessment date and the validation date is wider? So it means that your boss assesses you on one day and he validates you after 6 months. It means that he might have forgotten everything and he validates just for the sake of paperwork. So it means that it has not happened, or it doesn't have a good value. So based on this thing, I will say better to have your CBD and PBAs validated and assessed at the closer date rather than wide apart. You can see, have a look at your guidelines from the Royal College. They will definitely have some guidelines on validation of your CBDs and PBAs. Examination is covered in MRCS level. Yes, that's right. Perfect. Thank you very much. Thank you. Can I get a certificate? No, this is not this. There's no certificate for this session. Sorry, guys. There's no certificate. Any questions? I'm happy to explain. Please give a feedback form, which will. Yeah, yes, Vinay.
Hi, thanks again. I was just wanting to ask about triangulation, and I know this is quite sort of, it can be a topic of itself. But basically, from my understanding, is that for triangulation of evidence, you're taking things like CBDs and reflections and maybe some courses that you've attended and sort of
No, triangulation
emphasizing
of
on.
evidence is for example, you are doing a CBD and your referee gives you a CBD. Referee gives you a statement saying that he did a CBD on yeah, under my name, like his clinical skills are excellent, or something like that in your reference. Okay, and
Okay.
then in one of your appraisal, the appraiser says that I had a look at his CBD which he did, and it was up to the level of consultant level. Do you get me what I mean?
Yeah.
So this is called as triangulation. If you see the assessors mention that uh, we looked at these sections for this evidence. For example, clinical knowledge or work-based assessment. We looked at the appraisal. We looked at the clinic referees section about the clinical knowledge. We looked at the M&M meeting, and see, and this is called as triangulation. So this is, your clinical knowledge is assessed at all the sections. It's not just your CBD alone.
Sorry,
Okay.
just with regard to triangulation, my understanding about triangulation is
May I know
checking
who's
your.
this speaking? Sorry, guys, you have to mention your name and talk, please.
Sorry, my name is Hassan, Dr. Abdu Hassan. I have
Yes,
just
Hassan.
sorry,
Yes, yes,
sorry, yeah.
yes, sir. Listen.
Yeah, sorry for this. Yeah, just because this triangulation, as he mentioned, yeah, it's appearing any time of Caesar pathway, portfolio pathway, triangulation. My understanding is it something to do with checking your evidence, for example, in a way that, for example, if you said I provided a teaching one day, as the same day you should not be doing, for example, another activity. That
No,
is
it's not
checking
like
your
that.
evidence.
No,
Is
it
this
is
not
not like that.
triangulation or that is something different?
No, it is not like that. It's not like triangulation is, they are trying to verify your evidences at different sections and at different areas. For example, your logbook says that you have done some procedure. For example, if you are a medical doctor, I can say you have done some lumbar puncture at some point in your some particular day, and then your referee says that he is good at lumbar puncture, and your appraisal says that he has done lumbar puncture, and he had an appreciation because of this from this patient, and this is called as triangulation. It's not like you have done this and you have done this, but it has to correlate with your, for example, you have your logbook says that you have done lumbar puncture on 1st of January 2026, and your procedure based assessment or your mini what is this, like DOPS. If your DOPS says that you have done lumbar puncture on 1st of January 2026, so they are just linking the dots, they are just connecting all these dots, saying that your evidence is perfect. This is called as triangulation. Yes, Ponudurai.
Hi, Varun. This is regarding the paper-based format. I faced one procedure-based assessment. I couldn't get the ISCP, so I did the paper-based. When I write, very difficult to write in the space, so I used the type format. What is your recommendation? Is it we had to sign from all the pages to consultant signature or last page?
Basically, once upon a time, like not once upon a time, like few years back, they said there's no need for any signature from the for the paper based thing, and you just need the GMC number if it is inside the UK. If it is outside the UK, they want all the hospital seals, signature, and everything. What I will recommend is better to get signature from all the pages, and better to mention the GMC number from in the all the pages, and better to have a hospital seal in the all the pages. That's what I will recommend, but it depends on the assessor. And when it goes to quality check, that's the problem. There are two assessment here. One is the assessment by the doctors from the Royal College, one is the assessment by the clerical people looking for the validated, looking for the quality of the paperworks. So when it comes to quality of the paperwork, they might say, oh, this is this quality, there's no signature. It might be one of the reason for rejection. They can say that, oh, this CBD is not accepted because it doesn't have a signature. Why do you want to give that space for them to reject your application? I will say just go ahead and get, if you are going, it's not a big deal for the bosses to sign all these 6 pages. You're not going to if it is CBD, it might not cross more than 3 to 4 pages. If it is PBA, it's not going to cross more than 5 to 6 pages, so 6 to 7 pages. Just get it signed at the bottom of the, I usually prefer to convert to a Word document, create a footer, could create a footer or header saying seal, hospital seal, and GMC number, assessor signature, GMC number, and put a seal in the footer, and then create it for all the pages and ask the boss to sign all the pages. They're just going to scribble a couple of signatures. That's it.
Thank you very much.
That will give you a valid thing. Any other questions, guys? That's a good attendance. I want everyone to give a feedback, because that will help the association to get recognition. So we are planning to get some recognition from the GMC and Royal Colleges. So if you guys give us a feedback, then it will help the association to make it more formal and make it more um, useful for other people as well. I think we can call it a day if no one has any questions. All right, guys. Thank you. Thanks a lot. I want everyone to send a feedback for sure. Thank you. Thank you all for attending the meeting. Thank you.
Thanks.
Thank you.